So something that was quite interesting to me because I know that a number of persons need it, and is free fibroid surgery for patients that I think for anyone around though, but it's actually holding in Lagos. So somewhere in the case, there's a Love World Medical Center. Try and link it up here so that you can actually visit them whenever you have the chance. Okay, not whenever you have the chance, so within the period of duration, which I think running for this period of this month of March. That way, so if you're in Lagos or it's a virus and you know that you have fibroid issues, you need fibroid surgery, there's a link. Click the link, register for your screening process. You get screened. If you get chosen, then you can go for the surgery. I'm not part of the center though, so I can't tell you if you need to. I can't tell you if you actually need to make any payments though. But my thought process is that you can check it out. You can actually check it out. Reach out, not overthink it if you need it. Reach out, get to them. If you are booked for the screening, you can ask for clarification, then you can go for your screening and see what it actually is. If you have fibroids, how do you know whether they need to be removed? Usually, we say that most about 50% of women can have fibroids, and they are not an issue if you get pregnant, you don't have any problem with your periods, you have not having any pain, it's not very big or growing very large. You just find it. In fact, if it's something that you just found out because you're doing another random scan, there's no issue. However, if it's that you are started having some, what are you? All right. So if you found it incidentally and you are not having any issues, likely not. If a doctor has recommended that you take out your fibroids before, then you need to take it out likely. If your fibroid is making you to have very heavy periods and you are bleeding a lot, you likely need to take it out. If you have been trying to get pregnant for a long time and you've been told that the fibroid is at a position that may be blocking your tubes, or they are a loss, they're not affecting your womb or affecting the endometrium where the baby is meant to stay, you need to take it out. If your fibroid is causing you serious pain and it has become unbearable, you need to take it out. Even if it's not unbearable, but you're having a lot of pain and it has been identified that the fibroid is the cause, then you actually need to take it out. If you have been experiencing that your stomach is getting bigger, start experiencing something hard just above your pelvic region. Okay, how do I change pelvic region to something above just beneath your stomach? Okay, something like here. Yeah, it's usually here. So if you are experiencing something hard there and it's growing bigger, you need to take it out. If you felt you've been pregnant for months and going to a year or 2 years and the baby is not coming out, you need to take it out. If you went to the hospital and you thought you were pregnant, they told you that is fibroid, you need to take it out. Those are some of the symptoms that are making it necessary for you to actually take out your fibroids. So if you fall within any of these categories, maybe a few other categories I've not listed, but you know that you've been advised to take it out before, especially by your doctor, then reach out to them. I'll try and link it up some here so you can see the link that you used to get to them. See if you will be eligible for the free fibroid surgeries, and go get yourself out there before to get your delivery. Okay, so somebody asked, what are the dangers of doing a fibroid surgery? In terms of doing a fibroid surgery, I generally like all the dangers that doing any surgery has, which is the worst one that everybody fears death. But medicine has advanced. Medicine has gone very far. It's now very difficult to actually. I consider it very difficult to die on the table. Especially, I know we're in Nigeria, but for most centers that are now better standard, it's no longer a regular thing like that. So death is very low on the list. The other thing that should I start from the terrible one or should I start from the regular one is that most people, 90 something people, and once I remember is that there was a time I was at a hospital. I think I don't like mentioning some hospitals' names except for specific purposes, so I leave it out. And we went through the theater list, I went through the theater list for a couple of months, and I saw that they had about 1,000 surgeries. It's a very busy government hospital, so they've had about 1,000 surgeries, and in these 1,000 surgeries, there had been no death on the table. 1,000. They had 3 deaths during delivery that I was aware of and that I saw a track of, and they were women that were being managed at traditional homes or something like that. About one of the patients had womb rupture, burst because they induced out too much. I remember one of them came in, I think she was already having symptoms of eclampsia. Eclampsia is when your blood pressure gets very high in pregnancy. And she started having a stroke, seizures, was getting very bad before they brought her. The last case, I can't recall, but I was the one on. So those are patients that died. That means we are not even their patients, the patients that came in very bad from other, being in very bad states from other facilities. So that's how much surgery has gotten better, right? Then beyond that one, there was the possibility that maybe when they go in, worst possible case, they okay, the pain, I guess, from those things, but you get anesthesia, so that is down. Um, Scar, we use subcutaneous closing now, so it does not really have any good scar. And you can even get laparoscopic surgeries for your fibroids if they are not big, so that one does not even need open surgery. Some people do get phantom pain after a while because they have to transcend some nerves, right? So some people can get the pain for some time after that. They take painkillers and that usually can help. Okay, bleeding, maybe you're on the table and the bleeding is so much at very worst case, they have to take out the entire wound. The fibroids are very big. Usually, when we will go for that is, okay, this is the sound now because calling the patient. So I think we should go again one more time. Okay, so the other one is that um where was I? So yeah, some fibers are very big. They've been left for very long. But the thing is that okay, so like I was saying, but now I'm moving that way because I'm trying to like it's a Sunday with steps. So like I was saying, the other one is so when it has like disturbed the uterus a lot, we don't usually go for taking it out except maybe the woman has completed her family size. And what we mean is that maybe you've delivered all of your pregnancies and all that, so can opt to actually take out the uterus if you've given birth to all of your babies and you're like in an advanced age. I think that's that. What other likely complications that come into it? Very rarely would you say scarring that maybe can now make it more difficult. But for that to happen, it means that you have to have like a lot of fibroids already, and those are the major things that you are there to worry about. So the summary of it is that it's recommended for you to take out your fibroids if they are giving you issues, so that you can actually get your symptoms resolved. If you're trying to get pregnant, you can get pregnant after that, and those can actually help you. And with that, you should be free. Any other question again? Okay, recovery period. Depends on if it's a open one or a laparoscopic one. Likely going to be an open one, sure. So if it is an open one, then what makes sense is you'll be in the hospital for a couple of days. Usually it can be 48 hours, 72, depending on your facility. If everything is fine, then you go home, get wound dressing done for a week into 2 weeks, depending on how your healing goes. Then you continue normally and normal healing process. That's all.